Hi guys.
Hello.
Hi, welcome everyone to LoveRose Talks. Today I have the pleasure of introducing you to Isabel White, who is a cancer care nurse and also a sexual therapist. And welcome, Isabel, to LoveRose.
Hi, Caroline. Hi, Sarah. Really nice to be invited and really looking forward to our discussions today.
Well, let's start off, Isabel, with I suppose the big question of how does a cancer diagnosis, how does it affect intimacy in a relationship?
I think sometimes it's helpful to think of the ways in which sexual intimacy can be affected by cancer and its treatment separately, and split it into three key components: physical, emotional, and relationship impacts. But of course, in reality, those things overlap and impact on each other. But if we start with thinking about physical impacts, one area is vaginal dryness, which I know a lot of women experience. Usually that happens after they've had chemotherapy, or it may be that they're on endocrine treatment for their breast cancer, and that can lead to them experiencing sexual pain as a result of vaginal dryness and vaginal atrophy or thinning, if you like, of the vaginal lining as well. Then another area that a lot of ladies complain about is hot flushes and night sweats. And it's more that those are related to treatment-induced menopause, but they can be triggered by and disrupt sexual intimacy when you're trying to be intimate with a partner. Changes in breast sensation, particularly after breast surgery or radiotherapy. And if you have had to have your surgery has resulted in you losing a breast and maybe having that breast reconstructed, then it may be that, again, you've lost nipple sensation and you don't have your original nipple, that again, a nipple may be reconstructed for you, but it doesn't have the same sensation and appearance as before. And then reduced sexual desire and sense of feeling sexually aroused. And that can be caused by both physical and emotional issues, but certainly changes in estrogen levels through endocrine treatment and suppression of estrogen. They can all be physical effects. And then thinking about the kind of emotional or emotional impacts, those would clearly be things like changes in our body image and how we feel about our bodies, and maybe a reduced sexual confidence, changes in how our self-esteem feels, loss of sexual confidence specifically, reduced body confidence, maybe an increase in anxiety or a dip in our mood and actually feeling quite low. And the impact again of estrogen suppression on desire and arousability is both emotional and physical. Partly because when we have reduced estrogen, we might experience greater anxiety, but also we might feel more emotionally vulnerable than normal as well. And then last but by no means least, I think the whole area of relationships. I appreciate there might be some ladies who aren't in a current relationship, but they may worry about a future relationship and how they approach that after having had treatment for cancer. I think for women who are in a current relationship, they may worry that their partners no longer find them sexually attractive. Partners might worry that they're going to hurt their partner who's gone through treatment and who's experiencing challenges and difficulties, particularly during sex, or they may have tried to be sexually intimate together and actually they've seen sexual pain happen to their partner, and that makes them want to withdraw and perhaps not be sexual with their partner anymore because they want to protect their partner. There might be difficulty in the couples actually talking about sex, because even if we've been together a long while, sometimes it's just really, really tough to talk about something so private and so intimate and still so individual, even though we know one another very well. There might be difficulty in our partners fully understanding specifically what changes have happened in our bodies and in our minds. And unless we're able to share that with them, they may find it difficult to appreciate what's different now and compared to before diagnosis and before treatment. And then last but by no means least, I think just difficulties in exploring together what might need to change. So, you know, we get used to being together, thinking about how our bodies respond to each other when we're being sexual, and we take so much of that for granted. But if that's changed through the experience of going through treatment, we might need to renegotiate what that feels like and what that looks like for the future.
That's great, a kind of really great overview. And we'll talk in the next video about the practical tips and solutions to those problems.